Hello, and thank you for joining this OncLive peer exchange titled Management of Myeloproliferative Neoplasms, focused on polycythemia vera and myelofibrosis. Myeloproliferative neoplasms are often challenging to treat and may require years of therapy and follow-up care. Prognosis is dependent on the specific disorder and response to treatment. Today, I am joined by a group of my colleagues who are renowned experts in the field of myeloproliferative neoplasm research. During the next 90 minutes, we will discuss evolving research surrounding the treatment of polycythemia vera and myelofibrosis. We'll talk about treatment approaches and highlight emerging agents. I am Dr. Harry Erba, and I am a professor of medicine and director of both the leukemia program and the phase 1 program in hematologic malignancies at Duke University in Durham, North Carolina. Participating today on our distinguished panel are Dr. Rami Kamroji, Senior Member and Professor of Oncologic Sciences, Section Head for Leukemia and Myelodysplastic Syndrome, and Vice Chair of the Malignant Hematology Department at Moffitt Cancer Center in Tampa, Florida. Dr. Ruben Mesa, Director of Mays Cancer Center, the Mays Family Foundation Distinguished University Presidential Chair, and a Professor of Medicine at UT Health San Antonio MD Anderson Cancer Center in San Antonio, Texas. Dr. Jamil Shamo, Professor of Medicine and Director of the MDS, MPN, and Aplastic Anemia Program in the Section of Hematology at Rush University Medical Center in Chicago, Illinois, and Dr. Serge Verstostek, the United Energy Resources Incorporated Professor of Medicine and Director of the Hans A. Pielens Clinical Research Center for Myeloproliferative Neoplasms of the Department of Leukemia at MD Anderson Cancer Center in Houston, Texas. Thank you so much for joining us. Let's begin. So let's get started with an overview of the myeloproliferative neoplasms. And I'm going to start with you, Ruben. Just how common are the myeloproliferative neoplasms?
Well, it's a good question, Harry. Certainly patients always ask this, doctor, is this a rare disease? And what I share with them, I view it that it's neither rare nor common. Overall, it's a little over 3 to 350,000 patients in the U.S. The incidence is fairly low. So in each of the diseases, for myelofibrosis, maybe that's around 1 per 100,000 per year. In polycythemia vera and essential thrombocythemia, maybe a little bit higher, maybe closer to 2 per 100,000 per year. Where the prevalence is actually quite a bit higher is really due to the longevity that these patients really face, particularly with ET and P vera. So again, compared to other really rare disorders, in aggregate, they're much more common than, let's say, CML or other similar disorders.
Okay. So the myeloproliferative neoplasms used to be called the chronic myeloproliferative disorders, and that term was first coined by Damashek decades ago. And what he noticed was a group of diseases affecting his patients that have certain things in common. And I think these things, these features are common to all of the diseases we're going to talk about today. Patients will have high blood counts. They will have splenomegaly and symptoms from it. They'll have constitutional symptoms. There was also a particular progression to acute leukemia in some of the patients, sometimes more common, like in CML, sometimes less common, or what they used to call, or what we used to call a spent phase, which I guess we now call the fibrotic phase, or the post-PV or post-ET myelofibrosis. What was really prescient about the classification by Damashek was the other thing that the myeloproliferative neoplasms have been found to have in common. He hypothesized back then that someday we would find out that all of these disorders, neoplasms now, are classified together because of aberrant signals that govern normal hematopoiesis. And that's exactly what has been found starting with chronic myeloid leukemia in 1960 with the Philadelphia chromosome, and then other genetic abnormalities such as the JAK2 mutation and many others that we're going to talk about today.